Hi, I'm Stephanie, the PT with the Note Ninjas, and together with Nicole, the OT, we help PTs, OTs, assistants, and students with treatment planning and documentation. So today we wanted to talk about using external cue for some hip straightening exercises. You can use these exercises for ambulation, for ADLs, for functional activities, and instead of cueing your patient, increase hip height, increase knee height, bring your leg up higher, you can use an external cue. So we have a resistance band on the walker. You can use this on a walker, or you can use it on the legs of a chair or something else, just the right height for the patient to reach. So if your patient is going to be doing marching or hip flexion during your treatment session, instead of saying, bring your knees up higher, knees to stomach, you can put this band here and have the patient just march up. And they can alternate and just say, go high enough that you hit the resistance band. I feel like this is so much easier and would definitely even keep me at the right height. And then you can say how many times you've cued them. If they require more verbal cues, maybe just the external cue is enough. You can also do this with the knee straight. You can do one leg at a time, two legs, however you want. And then again, you can also turn to the side for hip abduction. With this, I would use maybe a railing, a bar, something more sturdy to hang on to. But just for this demonstration, I'm going to hold on to the walker. But you would have the patient lift their leg out to the side and make sure they tap the band. And then you could also do backwards, have them touch it this way. Sometimes this is better. If you give so many verbal cues, it's not as good with carryover. Sometimes your patients really get used to just hear you tell them what to do. They don't pay as much attention. Using an external cue like the band to help them gauge how far they have to go and pay more attention to their height really can help with the carryover and being consistent with the exercise. It's also great if you're giving it as a home exercise program when you're not there to cue the patient all the time. This is a great idea for treatment sessions, and it shows your skill in your documentation. So make sure to follow us at the Note Ninjas for more treatment ideas and documentation tips.